Hello everyone and welcome. Today we're going to explore injuries, fractures, and sprains. This is an important topic that covers common injuries and how to handle them effectively. Over the course of this presentation, we'll discuss the different types of injuries, their causes, and best practices for treatment and prevention. I'm glad you're here, so let's get started. Let's start by understanding what a laceration is. A laceration is essentially a wound caused by tearing or cutting of the skin and the tissues underneath. These wounds tend to be irregular and jagged, and you might also hear them called deep cuts. They can happen in many situations, especially when there's trauma or injury. Now moving on to puncture wounds. These are a bit different. A puncture wound is caused by a sharp, pointed object that penetrates the skin. Think of nails, needles, tacks, or even animal teeth. Usually, these wounds are small but deep, creating a narrow opening. One important thing to remember about puncture wounds is that, although they might not bleed a lot at first, they are particularly prone to infection. That's why they need to be treated promptly and carefully. Understanding these terms helps us recognize different types of injuries, which is essential for providing the right care and preventing complications. This knowledge connects directly to our overall goal of effective wound management and ensuring patient safety. Let's take a closer look at the different types of fractures. First, we'll start with classification based on skin involvement. An open, or what we call a compound fracture, occurs when the broken bone actually pierces through the skin. This type of fracture is particularly concerning because it exposes the bone and surrounding tissues, which significantly increases the risk of infection. On the other hand, a closed or simple fracture means the bone is broken but the skin remains unbroken. These are generally less risky in terms of infection, but still require careful management. Next, let's explore classification based on the fracture line itself. A transverse fracture is when the break runs straight across the bone, perpendicular to its long axis. Think of it like a clean cut across a stick. An oblique fracture occurs at an angle across the bone shaft, which can sometimes make treatment a bit more complex due to the angle of the break. Then we have spiral fractures, which twist around the bone, often caused by a twisting or rotational force. Imagine twisting a stick until it cracks. Finally, linear fractures run parallel to the long axis of the bone, forming a straight line along its length. Understanding these types helps us better assess the injury and determine the most appropriate treatment plan. Today, we're going to explore the different types of fractures. Fractures are essentially breaks in the bone, but not all fractures are the same. Some are simple, while others can be more complex, and understanding these differences is key to proper treatment. First, we have the simple fracture, which is also called a closed fracture. In this case, the bone breaks but doesn't pierce through the skin. It's usually less complicated to treat because there's no open wound involved. Next, there's the open fracture or a compound fracture. This happens when the broken bone punctures the skin, creating a wound. These are more serious because of the risk of infection and the need for more complex medical intervention. We also encounter displaced fractures, where the bone pieces are out of their normal alignment. This often requires realignment or reduction to heal properly. Then there are non-displaced fractures. In these cases, the bone cracks but maintains its proper position. These tend to heal faster and with less intervention. Lastly, we should mention stress fractures, which are tiny cracks caused by overuse or repeated stress. They're common in athletes and require a different approach to healing. Understanding these different types helps us grasp the complexity of bone injuries and guides us toward the appropriate treatment strategies. As we go forward, keep in mind how each fracture type impacts recovery and care. All right, let's talk about different outcomes of fracture healing. First, we have malunion. This happens when a broken bone heals in an abnormal position, which can lead to functional problems or even a visible deformity. It's like the bone heals, but not quite in the right place, and that can affect movement or appearance. Next is non-union, which is when a fracture simply fails to heal altogether, even after a long period. It's as if the healing process just stalls and the bone never properly reunites. This can be quite problematic and often requires further intervention. Then there's delayed healing. This refers to cases where the fracture takes longer than usual to heal, but it's still expected to eventually heal without needing additional surgery. It's a bit of a waiting game, but progress is still happening. Finally, routine healing is what we're aiming for, when the bone heals as expected without any complications or delays. It's the ideal scenario, where everything proceeds normally. Understanding these different outcomes helps us evaluate how well a fracture is healing and guides our next steps in treatment. Let's take a closer look at the coding guidelines for fractures. First, the location of the fracture is identified by the first 3 digits of the code. This is crucial because it tells us the general area, such as the skull, neck, or trunk. Knowing this helps us categorize the fracture accurately. Next, we need to determine if the fracture is open or closed. An open fracture involves a wound in the skin, meaning the bone has broken through. If there's no mention of this, we should assume it's a closed fracture, which means the skin remains intact. This distinction is important for coding and treatment considerations. Then, we consider whether the fracture is traumatic or pathologic. Traumatic fractures happen due to injury, like a fall or accident. Pathologic fractures, on the other hand, result from a pre-existing disease, such as osteoporosis. If the type isn't specified, we typically assume it's traumatic. Understanding this helps us select the correct code and interpret the case properly. Finally, when coding, we refer to the ICD-10 CM manual, specifically the alphabetical index and the tabular list. These tools guide us to find the most precise code for each fracture. Accurate coding depends on carefully consulting these resources to ensure we're capturing all relevant details. Connecting this to the overall theme, mastering these guidelines ensures that our coding is accurate, which is essential for proper documentation, billing, and statistical analysis in healthcare. When it comes to coding fractures, one of the key distinctions we need to make is between displaced and non-displaced fractures. If the documentation doesn't specify whether the fracture is displaced or non-displaced, the default coding is to treat it as displaced. This is important because it impacts how we code and report these injuries. Moving on to superficial injuries, like abrasions or minor cuts, these are generally not coded if they occur alongside more severe injuries at the same site. So, if a patient has a more serious injury, the superficial injury doesn't get its own code. Now, regarding primary injuries that involve damage to nerves or blood vessels, things like lacerations or punctures, if the damage is minor, we sequence the primary injury first. That means we code the main injury initially, followed by the nerve or blood vessel injury. This approach helps to accurately reflect the injury severity and the treatment focus. Understanding these nuances is crucial for precise coding, which ultimately supports better patient documentation and reimbursement. These guidelines help us stay consistent and ensure we are capturing the full scope of the injuries involved. Let's talk about the 7th character in fracture codes within ICD-10 CM. This character gives us important details about the fracture, specifically the stage of treatment and the nature of the injury. It's a small character, but it carries a lot of weight for accurate coding and billing. Now, when we look at common 7th character options for traumatic fractures, each one helps specify exactly what's happening. For example, an A indicates the initial encounter for a closed fracture. This is when the patient is first seen after the injury and the bone isn't broken through the skin. If the fracture is open, meaning the bone has broken through the skin, then we use B for the initial encounter for open fractures of type I or II, or when the open fracture type isn't specified. For more severe open fractures, like type IIIA, IIIB, or IIIC, we use C to specify that initial encounter. Moving on to follow-up or healing stages, D is used for subsequent encounters when the fracture is healing normally in a closed fracture. Similarly, E applies when there's a follow-up for an open fracture of type I or II with routine healing. If healing is delayed, we use G for subsequent encounters where the fracture isn't healing as expected. When the bone isn't healing at all, with a non-union, we use K if the fracture has healed but the patient experiences ongoing issues like deformity or pain. P indicates a malunion. Finally, S is used when the patient is dealing with sequela, which means late effects or complications resulting from the fracture that can occur months or even years later. Understanding these characters is key because they help us communicate the exact situation of the fracture. This ensures proper coding, which impacts billing, treatment planning, and tracking health outcomes. It's a small detail, but it makes a big difference in the accuracy and quality of medical documentation. When we talk about the initial encounter for a fracture, it's really about the first steps in active treatment. The goal here is to realign the broken bone and stabilize it, often using a splint or cast. This initial management is crucial because it helps prevent further damage and sets the stage for healing. Once stabilized, ongoing care becomes important to promote proper healing and to watch out for any complications that might arise. For example, if the fracture requires surgical intervention, one common procedure is open reduction and internal fixation, or ORIF. This involves surgically realigning the bones and fixing them in place with hardware like plates or screws. In emergency departments, the focus is on quick evaluation and stabilization, making sure the patient is safe and the fracture is managed properly to prevent further injury. Sometimes, a patient might need to see a new specialist, such as an orthopedist, for more specialized care or to plan further treatment. And of course, treatment plans aren't static. They can change based on how the patient responds or if new issues develop. Adjustments are often necessary to ensure the best possible outcome. Overall, this initial encounter sets the foundation for effective fracture management, emphasizing stabilization, thorough evaluation, and adaptable care plans. Now, let's talk about subsequent encounters for fractures with routine healing. When coding these encounters in ICD10 CM, we mainly use the 7th character D. This character indicates that the patient is receiving routine care during the healing or recovery phase after active treatment has already been completed. It's important to recognize that this code reflects standard follow-up care, confirming that the fracture is healing as expected. Moving on to subsequent encounters where healing is delayed, ICD-10 CM guidelines specify that these refer to medical visits after the initial treatment, but during a phase where the fracture isn't healing at the expected rate. Here, the 7th character changes to indicate this delayed healing, often using G. This distinction is crucial because it helps us document cases where healing is slower than normal, and it guides appropriate treatment planning. Overall, understanding these different coding nuances ensures we accurately capture the patient's healing status, which is essential for proper documentation, billing, and quality of care. Recognizing how the 7th character modifies the code allows us to reflect whether the fracture is healing normally or experiencing delays. Now, let's talk about the sequela of a fracture, which is essentially the late effects or complications that can occur after a fracture has healed. The key point here is that the 7th character in the ICD-10 coding for sequela is S. This S indicates that the patient is experiencing a condition or complication that directly results from the original fracture. For example, if a patient has persistent pain or a permanent limp due to a previous fracture, you would code that condition first. Then, when coding the fracture itself, you would include the 7th character S to specify that this is a sequela or a late effect of that initial injury. So the main takeaway is that you first report the code for the specific sequela, like the limp, and then follow it with the fracture code that includes the 7th character, S. This helps ensure that the patient's ongoing or late effects are accurately documented and linked to the original injury. Understanding this connection is crucial for precise coding and appropriate patient care documentation.